Okay, good morning, everybody. I'm Christine Jacobs, and I'm the Executive Director of Represent PA. We are the PAC in Pennsylvania dedicated to electing empowering pro-choice progressive women in Harrisburg. And we're very, I keep getting calls these days from people who want us to support candidates for city council or judge or many other races. But we've decided that we're fully focused on Harrisburg, and you're going to hear why in just a minute. Before we get with our guests, I just want to let you know what effect we've already had. We are one of probably 50 groups in Pennsylvania who take full credit for now having a Democratic majority. I mean, I know it was us, but everybody who did turnout and contacted people and all the other people in Pennsylvania were also part of it. But we do have a Democratic majority in the House. And I want to make sure you're paying attention to what's going on in Harrisburg and what the effect of the new Democratic majority is. In the budget hearings, there's actually discussions on things that we have about real values. Yes, the governor introduced his plan, but if you listen to or read about what some of the other discussions are about education and about the environment and about so many other issues in Pennsylvania, the budget is where you can see the values of our legislators. Committee chairs are another place that you can see a big change. We have Democratic committee chairs because that's the way it works. And they're done by seniority, but there are some really strong Democrats in many of the seats. One of my favorite that I look forward to see what she does is the Ethics Committee. And Representative Donna Bullock is the chair of the Ethics Committee. Many of you have heard Donna talk about on some of our past breakfast briefings. And so you'll agree with me that she's the right person to have those conversations. But this week has been a really big week for talking about new legislation in Harrisburg, education that hasn't been talked about under the Republican majority forever. For example, the LGBTQ equality bill was voted out of committee this week, voted out of committee. It was first proposed 22 years ago. And under Republican and Democratic governors, under Republican and Democratic legislatures, this has not gone through. And it has passed, and it's heading to the main floor of the House. It faces a tough battle probably in the Senate, but we're making progress. It's also a great stamp of approval for reflective democracy. By changing out the players, both Republicans and Democrats in Harrisburg, we have people who understand the real issues of all Pennsylvanians. And I'm really personally very proud of this legislation. Personal privacy. Do you know it's perfectly legal right now for women to get an vaginal exam while they're under anesthesia, and it's been done for years as part of, let's train doctors on how to do this. The patient will never know. That patients now have to give, or will soon have to give, the authority for that to be done. I talked to State Rep Liz Fiedler the other day about this, and she's so proud. And she's in her third term, and this legislation was sponsored by she and Rep Hanbidge, who are both in their third term. They've both been endorsed for all three of their elections, and this is in all of her years in the legislature. This is the first time she's had legislation voted out of committee. Another thing that's been going on is discussion about voting rights. And, those of us who make use of the mail-in ballot process, they don't open your ballots until after the polls close on election day by law. And the counties have been saying, hey, give us more time so we can cure the ballots, so we can take a look at them and make sure that they're properly filled in. This legislation is actually being discussed. And there's so much more, and we're going to keep you up to date on this as things go on. But I want you to take real pride in the fact that we've been part of this process. Now we got to increase the majority in the House, and we really need to flip the Senate to make sure that all of these things can happen. Now, getting to the main part of our agenda for today. Food insecurity. It isn't something that we all think about a lot, but in Pennsylvania, probably over 1 million people, including 300,000 children, are facing food insecurity or downright hunger. Many of the households that receive SNAP benefits have children. SNAP benefits had increased during the pandemic as part of relief efforts, but they're declining. The annual food budget shortfall is probably $600 million, and food insecurity rate is 8.9% by some ratings. This is in the state of Pennsylvania in the year 2023. As I mentioned, emergency aid during the pandemic helped bring a number of children and families out of poverty, but because people were getting extra benefits, but those are expiring. The Shapiro administration reminded people of changes to the SNAP benefit and urged support for charitable food networks. Today, you're going to hear from a couple of those charitable food networks, but the real answer is making sure that our people are fed. Today, you're going to hear from all sides of this discussion: a legislator looking to make change, nonprofit groups advocating for change, and frontline groups providing aid to prevent hunger. So Emily Kinkead is in her second term in the state legislature representing Allegheny County, and she's co-chair of the Legislative Hunger Caucus. So she was the right person for us to have on this call today. We also have Loree Jones-Brown, who is the Chief Executive Officer of Philabundance in Philadelphia. She's had a long record of service within Philadelphia and with the Commonwealth of Pennsylvania, but this is her biggest challenge, and she's really making Philabundance an important organization in Philadelphia. Ken Regal is the Executive Director of Just Harvest. Just Harvest sits on a number of the boards in Allegheny County looking for a healthier county, and this is his area, and we're really proud of him for joining us today. And finally, Colleen Young is the Director of Government Affairs at the Greater Pittsburgh Community Food Bank. Again, what we've tried to do is look at all of Pennsylvania, look at efforts all across the Commonwealth, and bring you a complete issue on what's going on in this field. So with that, I give you our Emily Kinkead, state representative. And Emily, tell me that food is discussed in Harrisburg. Tell me that this is an issue that people care about. Tell me that it's going to make progress and what you're doing about it. So thank you for joining us.
Yeah, so this is definitely something that we're talking about in Harrisburg because of the SNAP benefits. I mean, it was something that the expiration of the pandemic benefits and sort of the signal flare that put up, especially with our district offices, to say, this is how you prepare for these conversations of these people who are going to come to your district offices and just be devastated at the lack of benefits, the loss of benefits, and the food insecurity that follows. And none of us believe that the actual answer that is, well, just go and rely on your charitable food network. Our charitable food network is incredible, and all of you guys do incredible work, but that shouldn't be the solution to the problem. It should be a tool. It should be a support. But when we say that, the government shouldn't spend any money to help people who are experiencing food insecurity, that we should rely on charity, I think as the government, we're not doing our jobs. So we have been talking about, and Governor Shapiro suggested included in his budget, an increase in SNAP benefits. And I am working on making sure that the PASS program and the state food purchase program, which the state food purchase program and PASS, which is the surplus, are in the same line item. So whenever there's an increase to the PASS program, it looks like there's an increase to the state food purchase program. But the state food purchase program is the single most effective state program in terms of addressing hunger. And so what I'm
tell us what that program does?
Sure. So it allows, and actually Colleen and Loree and Ken will probably be much better to explain it, but ultimately it allows the purchase of food at more affordable rates to get them to our charitable food network. But they so yeah, what I'm trying to do is get those separated out into two separate line items so that we actually can see when we are increasing the state food purchase program and how much we need to get to make sure that it is fully funded. So that's one aspect of it. The governor also included in his budget a fresh food purchase program. And in the past, our state has had this program. So we're not 100% clear if the governor is proposing to just reinitiate the previous program or if he's coming up with a new program. So we're still working out the details on that. But yeah, so addressing hunger is conversations are being had all over the place in a bunch of different ways. And we actually have, so I have legislation that would provide universal school meals, breakfast and lunch for all K through 12 public school students. I have the bill in the House. Senator Lindsey Williams and Senator Judy Schwank have it in the Senate. But Christine, as you were saying, we have a Democratic majority in the House. We have new chairs for all the committees. And so I'm optimistic that we're actually going to move this because Chairwoman Donna Bullock, who's not just the chair of the Ethics Committee, but is also the chair of the Children and Youth Committee, has been working on universal meals for a while. Pete Schweier, Chair Schweier, is the new education chair. And between them, this is a really important issue to work on. So they actually held a joint informational hearing for the Children and Youth Committee and the Education Committee to talk about school meals and the need for school meals and why this program is so necessary right now. Because again, during the pandemic, universal school meals were provided and we saw the benefits of that. We saw the way in which it addressed childhood hunger, because those are the meals that we consistently have. Those are the meals that kids are available for. They are in school, and if we're requiring them to be in school, then they should have meals available, and it shouldn't be a place where they're going hungry. So we saw the benefits of that during the pandemic, and so we are proposing to continue that in perpetuity. As part of that, I'm also working with Chair Schweier to increase the state supplement to the school districts that are community eligible, that they already provide universal meals, because the poverty level in those districts is 40% or higher. And so the federal government has increased their supplement for that program almost 100% in the last 15, 20 years, and the state has not kept up with that. So I'm also working on a proposal to actually increase that so that we can at least match what the federal government is providing. So all told, if we do all of this, it amounts to basically 0.01% of our overall budget. And so it's something, and the return on investment that we see from actually feeding people, from keeping people out of survival mode, and actually the ability to thrive and the ability to focus on other things around them, makes all the difference. And so the return on investment, I think, is just incalculable. But it's something that I think that, if we spend our money wisely, spending more money on certain things ultimately pays off in the long run.
So I've got a question for you on that. Is I believe you, I buy in. Who doesn't? Why would somebody not believe in this? Is it just worrying about the administrative state?
It's a little bit about the administrative state. It's a little bit about the price tag. It is, we've heard, for the pushback that I have heard, is, one that, well, I want to feed my kids at home. Well, why would I want to pay for school meals if I'm just going to feed my kid at home? And your child doesn't have to participate. You can still pack a lunch for them. They don't have to do that. But there are a lot of parents who don't feel like it is their responsibility to feed their kid at home or to send them with what they need in order to eat at school. And and not all of those kids meet the on paper threshold of being food insecure and qualifying for free or reduced lunch or free breakfast. And so, taking care of those kids is important. The other thing that we've heard is that my brain just totally turned off. But one of the other things we've heard is that so Senator Scott Martin, who's the Republican chair of the Appropriations Committee in the Senate, is he wrote an op-ed that among other things, in kind of refuting the governor's budget, basically said, well, if Joe Biden isn't prioritizing funding SNAP or funding school meals, then why should we? And in addition to just being incorrect, that yes, the pandemic levels of investment in those programs have expired and they haven't been renewed, and that's a Congress thing. Joe Biden in his budget actually included an increase to the community eligible provision and an increase to SNAP at the baseline, the pre-pandemic level. So he is actually proposing an investment in both of those programs. But at the same time, we have the money at the state level to be able to do this without the federal government. And so why wouldn't we? And
these are our children.
Yes, these are our children. These are, this is the future of Pennsylvania. This is how we get kids not just to be in a better place and be able to take advantage of opportunities, but also to develop a sort of a loyalty to Pennsylvania so they stay in Pennsylvania. Right. And, we are, especially in Western Pennsylvania, we are losing population and we want people to stay in Pennsylvania. And this is a great way to get families to move to Pennsylvania so that they can, and that they know that their kids are going to be taken care of. So those are sort of the two main things. In some ways, the arguments against this program it's a little specious, so it's things like, well, if they have universal meals, then they could eat multiple meals, and that's going to contribute to childhood obesity. And it's just these kinds of arguments that are they're just straw men. It's like that. I don't actually think that anybody believes that that's a real issue. We are having far more issues with kids having nutritious meals, right, and regular meals. And part of what's contributing to childhood obesity is the fact that they don't have regular nutritious meals, which right, is what we can provide through schools. So it just doesn't seem like a valid argument to me.
Well, thank you. And I want to thank you very much, Representative Kinkead, for starting us off this morning. I know you had another commitment this morning, but this is just an issue that's just so important to you that you agreed to join us first thing.
And I very much appreciate it. Thank you for shifting the schedule around for me. And I'm sure that I will see Loree and Colleen and Ken frequently in the future. And thank you guys. And if anybody has any questions, obviously Christine knows how to get in touch with me, but anybody who wants to reach out, if you have any other questions, please feel free. And thank you all. And
we look forward to supporting you in your re-election campaign.
Thank you for that.
You're welcome. Take care.
Talk to you later. All right. Bye.
So that was a great way for us to start off today, and a great way for us to, find out whether anybody in Harrisburg cares. But now let's hear from the ground. We've got we've got three great speakers who are going to be talking with you, and take it away. I think, Loree, you're starting off.
Yep. Yeah. Good morning. Thank you so much for this opportunity. Thank you, Chris. I'm so glad that we get to work together in this particular way, and excited to be a part of this conversation about something that's critically important. And I think you set it up really well, as did the representative, and I'll just fill in pieces there. I'm going to start off with sharing the definition of food insecurity, which is on the next slide, just so you know, just some level setting to understand what we're talking about. And we will use, for the purposes of our conversation, food insecurity and hunger interchangeably. But I wanted people to know it's about a lack of consistent access to food, to have an active, healthy lifestyle. I bring that up and I want to underscore it because it could be that on a given day, a given week, in a month, that you don't have access to it. So people may traditionally think about poverty and what that looks like. This could be that somebody has a job, but the job does not pay them enough to really support provide all the needs to their family. So I wanted to know it's what the face of insecurity really looks like. I want to share a couple of kind of messages from the field. And I'm going to start off with a quote from one of our partners, Margot, who's the founder of the Sunday Love Project. Interestingly, just won a Philadelphia Award in the city of Philadelphia. So she is one of our pantries. And so we provide food to her that she then distributes to people who are hungry or food insecure. Margot said, "We're noticing an incredible influx of new clients. We're serving 120 to 150 people per day. There's a sense of desperation that's heightened. People are lining up earlier. There's a feeling of scarcity that didn't exist before." One of our neighbors who gets access to food for one of our pantries said, in response to questions about SNAP and the emergency allotments going away that Chris mentioned, neighbor said, "I work full time, and by the time I pay my bills, I have nothing left. I don't make a lot, and I'm only eligible for $90 in SNAP a month." So the reality is that people in our state are cobbling together their take-home pay, SNAP, and emergency resources at times, and that's still not enough. So that is the world that we're living in. If we can go to the next slide. Wanted to share what that looks like across the Commonwealth of Pennsylvania. You can see from the slide that darker green tells you where people are, where the food insecurity rates are higher, but you realize that the entire state is covered in some shade of green. So hunger exists in all 67 counties of our Commonwealth. In terms of what that looks like, you guys know the Commonwealth pretty well. The reality is that in areas like Philadelphia, where I am based, we serve both southeastern Pennsylvania and southern New Jersey, but also in rural areas, we see food insecurity increasing and increased. I want to say something else about what happened over the course of the pandemic. In 2020, we saw more and more people accessing the charitable food network. Nearly 40% of them were newly accessing it. So for the first time, because they had lost a job or because of the shutdown, they were coming to ask for help. But across this region, the Commonwealth and the country, we saw, and you saw, lines of people accessing the charitable food network. Well, interestingly, when the USDA surveyed people at the end of 2020, they found and reported that food insecurity in our country actually did not go up in 2020. How was this possible? Well, a few things happened. Government did increase the resources that it provided and enabled groups like the one Colleen works for and mine to put out more food, to double the amount of food that we put out. And so that helped. But if you look at those numbers, it kind of masked the reality for people on the ground. In rural areas, food insecurity still went up in Pennsylvania and across the country. For minority families, so for African Americans, for Native Americans, and interestingly, for families with children, if you go to the next slide, families with children. So while across the country and in our area, food insecurity seemed to be kind of stable, what we saw during this moment of crisis is those specific groups having an increase in food insecurity. This slide should really trouble you. So you see how it got darker green from the slide before? This is when we're focusing on child food insecurity in our Commonwealth. And you've already spoken about that, and I saw your message in the chat as well. This is absolutely unconscionable and something we can do something about. Just in our service area for Philabundance, there was child food insecurity was 17.3% in 2020, and that was a 25% increase over the prior year. So just really troubling, upsetting numbers and data, particularly about who's behind that. I'm going to go to the next slide. I gave you one example of why we care. There are many reasons that we should care, and you'll see some on the next slide, but part of it is the cost of hunger. Hunger is a social determinant of health. And we realize that when people are hungry and have poor nutrition, it leads to higher healthcare costs. So if you don't care about the people, if you care about the healthcare costs, you should care. The other reason you should care, if you only care about economics, and I think Colleen will touch on this too, as she talks about SNAP, with the SNAP emergency allotments that Chris referenced earlier, that meant $2 billion last year, $2 billion additional dollars coming into our state. So even if you don't care about people, but you care about the economy, imagine $2 billion being pulled out. And I remind people as we think about SNAP, we're not giving people, the government isn't giving people money to go spend on whatever they want. It literally is money for food, right? So I want to just make sure we underscore that. We can go to the next slide. Maybe click 2 times, I guess. Yeah. This is the impact of hunger. This is one of the things I learned not long after I started at Philabundance. It really was striking to me. When babies and children don't get enough nutrition early on, it negatively impacts their brain development. They obviously are not able to pay attention in school, so that affects their behavior as well as their educational advancement. We also find that when children don't have enough to eat, it again affects their health, but also can lead to suicidal ideation. And then we likely all know that for adults, there are the kind of very basic mental health impacts of it, or kind of how you feel on a given day, but it can lead to depression, but also more serious health issues like diabetes, hypertension. And so there definitely is, as you saw in the prior slide, a real health and therefore economic impact on hunger. So many reasons why I think that we should care about this work. The next slide, I'm going to wrap up pretty quickly to leave time for questions. Here's a slide. This map shows where we at Philabundance serve, but there are food banks like ours, like Colleen's across the Commonwealth. We serve in all 67 counties. We serve out southeastern Pennsylvania and southern New Jersey. We prioritize what we call our good food policy. We prioritize sourcing or acquiring, either through purchasing, through the government, or through donations, healthy food. So we challenge ourselves to provide people with healthier food, with variety and culturally diverse food. We also, wherever possible, are looking to purchase food more equitably. So to us, that means locally. And the representative talked about one of the programs that enables us to do that, the Pennsylvania Agricultural Surplus System Program. So we can purchase from local farmers and get that produce right in the hands and bellies of the people that we serve. And then also access. And we're actually looking at what they're doing out at Pittsburgh. We want to make sure that people can access the food through our pantries, which are churches, schools, synagogues, mosques, across our region. We want to make sure that those are open and accessible at times in ways that make sense for people, including piloting a really cool new locker program, like the Amazon locker program for food. In addition to providing food in the traditional way you would think a food bank does, we also are addressing the root causes. One key way we're doing that is through a workforce development program. So this is for people who are eligible for SNAP. It's a free 16-week program where they learn what we say, both knife skills and life skills. So people are learning culinary arts training so they can then work in kitchens at institutions, at restaurants across the area. And we had a really solid success rate. We then, through that program, have a meal production. So we're able to provide meals for people experiencing homelessness, for schools, for seniors and the like. I'm going to go to my next slide really quickly and wrap up. This just gives you an overview of who we are and the impact that we make. And you'll see this being very similar for our counterparts across the Commonwealth and also across the country. We distribute in a given year 50 million pounds of food. Pre-COVID, that was 25 million pounds. We really doubled that. Part of how we doubled it was additional government resources coming in. We're spending 10 times as much on food as we did pre-COVID. That's about the need increasing and wanting to put more food out, but it's also about the cost and supply chain issues that I know you're all familiar with. Through our community kitchen, we're able to provide about 400,000 meals a year. And so much of that is through, as I said, through places that are where people are experiencing homelessness. We also, interestingly, one year, were able to help with Afghan evacuees and provide them with culturally responsive meals. Part of how we do our work is by rescuing food. So you think about a restaurant, a catering operation, a grocery store that has food that is absolutely still safe and healthy. And rather than having that go to a landfill, we're able to get that in the hands of our partners and then to people who are food insecure. And I love that we get to travel so much, but we also have a slide, an image here of how much our fleet is circulating this area to get food in the hands of people. So I wanted to definitely save time for questions, but thank you for this opportunity. We obviously are a nonprofit. We're nonpartisan. What we say is that we're not Republican, Democrat, Independent, Working Party. We're for people who are food insecure. And I really appreciate that Represent PA is also for people who are food insecure and are joining us in this fight.
Thank you, Loree. We'll get to the questions at the end of all the presentations, but you had me in tears there a couple times. And yeah, we're nonpartisan, but we support people who want to make a difference. So actually, we're very partisan, but we understand these issues, and we want to we use these forums to educate people in Pennsylvania and across the U.S. So who's next?
That would be me. Good morning, everyone.
Morning.
As Christine mentioned, I'm Colleen Young, Greater Pittsburgh Community Food Bank Director of Government Affairs. Wonderful to be with you this morning, and thank you to Loree for setting it up so nicely. You could just go ahead and go to the next slide. So first, I just wanted to share, as Loree mentioned, we are really not just trying to feed people, but to try to identify the root causes of hunger and to address those so that we are moving towards ending hunger. And I put this up here because the Greater Pittsburgh Community Food Bank recently updated our mission statement to reflect those efforts. And I feel like that's sort of central to the tone of the conversation we're going to have. So I wanted to share that with you as we get started. And you can go to the next slide. So Representative Kinkead mentioned a few of these things already, so I will go through them fairly quickly, and then we'll have time for questions, as Christine mentioned at the end. But these are some of the budget priorities for the state budget, and then I'm going to talk briefly at the end about some of our federal priorities as well, even though we are focusing on Harrisburg today. I didn't want to miss that opportunity to talk about the Farm Bill. So as Representative Kinkead mentioned, there are multiple hunger priorities in the budget, and these priorities were come up with in partnership with the Pennsylvania Hunger Action Coalition, which all three of us on the call that are representing the Hunger Network are part of today. So I'm going to break it down into departments of agriculture, education, and human services, just so you can see where things fit within the budget. But as Representative Kinkead mentioned, one of the biggest programs that we have to address hunger in the state budget is the State Food Purchase Program. It's distributed out through counties, and oftentimes food banks are the recipients of those funds, but not always. But they go directly towards enabling us to purchase food to distribute out to the community. So a large percentage of the food, I believe for our food bank, I don't know about Loree's right now, we're just over 30% of our total food that we distribute is purchased. So that's quite a bit of food. We really need, given the high cost of food, for this number to be increased. Unfortunately, Governor Shapiro flat funded this program, and the Pennsylvania Agricultural Surplus System, which is sometimes called PASS. Those were both flat funded. As Representative Kinkead mentioned, they're on one line item. So oftentimes it's hard to separate them out, but they are actually very different programs. So we're hoping that the State Food Purchase Program will be increased to $26 million, which would fully fund that program and help us to account for the cost of inflation around food. And then for the Pennsylvania Agricultural Surplus System, as was mentioned, that enables us through our Feeding Pennsylvania network to purchase up surplus food from local Pennsylvania farms. And sometimes it's distributed directly, and sometimes it's reprocessed. So in the case, for example, during the pandemic, we were able to purchase up a lot of excess milk that wasn't going to schools, and then make that into cheese, which is more easily distributable and has a longer shelf life. So that's also reducing waste in the system. And we're really only asking for a very slight bump of $500,000 to get us up to $5 million to fully fund that program. I believe Representative Kinkead also mentioned the Fresh Food Financing Initiative very briefly. That would allow communities, especially communities that don't have access to fresh food currently. So a lot of historically disadvantaged communities to be able to have some funding to increase their infrastructure. So it could go to small local businesses, for example, to allow them to distribute fresh food in their communities. And then a small amount of money of $500,000 that we're asking for to distribute the senior food boxes. That's a federal program that I'll talk about shortly. It doesn't come with any distribution dollars. We had been getting some donated support from a company called DoorDash during the pandemic, but now that that has ended, we are absorbing those costs. And so for every dollar we're spending on distributing those boxes, we're not spending on meals, for households in our communities. You can go to the next slide. So the education budget, as we talked about earlier, we're advocating for free and healthy school meals for all. We are also advocating for the state supplement to be increased. So the state supplement currently, and since it was enacted in the year 2000 to 2001, in that year, it provides 10 cents for every meal on top of what the federal government reimburses for school meals. This is particularly important for schools that are eligible for community eligibility, as Representative Kinkead mentioned, but it's not exclusive to them. And one of the issues that we're seeing right now, particularly in our city schools, is that they are already over budget. So this year, the federal government has given schools an extra 40 cents on top of what they traditionally get as sort of like a last pandemic holdover to make sure they can afford food for students. That's ending at the end of this school year. So we already know that unless some federal action is taken, they will lose 40 cents per meal at the end of June. There has not been an increase in the state supplement in over 20 years, so it has not kept up with inflation or real meal costs. And even with that 40 cents, several schools are already over budget, and they know that going into next school year, they're facing a real crisis in being able just to afford food to feed the kids who already are part of the free and reduced lunch program. So we know that that's not a sustainable model. And when they're not allowed to go over budget and run a deficit. So when they do spend over, those monies get pulled out of other education spending in the district. And so the way we think about it is for every $100,000 that they go over budget, that's a teacher that they can't afford to hire. And then lastly, we're supporting the Hunger-Free Campus Initiative, which is $1 million to support colleges and universities to feed their students. And then lastly, the Department of Human Services budget, we are supporting what Governor Shapiro proposed to increase the minimum monthly SNAP benefit for seniors and people living with a disability. The federal minimum is $23. We are this year, it has been proposed to increase that very slightly to $35, which frankly is still not very much money. If you think about that's for your whole budget for a whole month to buy food. Other states have increased it quite significantly above that. New Jersey, I believe, has a minimum of $95. Even West Virginia has increased their minimum monthly SNAP benefit. So we are we're behind the curve here on our neighboring states of supporting this. And we feel like if we can get this into the budget, it'll set a precedent, hopefully, to be able to increase it further in future years. You can go to the next slide. And then I'm just checking the time. Very briefly, I'm just going to go over some federal things because I know you've heard about this. It's been in the news a lot lately. Number one priority that we're looking at right now is speaking out against the SNAP cuts that were proposed in the House GOP debt ceiling bill that just came out. That's really they're looking at increasing work requirements. We already know that work requirements don't work. They don't meaningfully increase work, and oftentimes they harm people who are working, but are not able to meet the strict requirements around paperwork. So we've got low-wage workers who are working, who are being kicked off of their SNAP benefits because they can't meet the demands required to fulfill the paperwork to prove that they're working. And for those that are not working, there already is a very strict limit of only being able to receive SNAP for 3 months across a total of 3 years. So even if you are not working, you take 3 months of benefits, then you find a job and you work for 2 years, and then something happens and you lose that job, you still are ineligible until the end of that 3-year cycle for more SNAP benefits. So the limitations that are in place are already extremely strict. And we are actually hoping to reduce those limitations, not increase them. Just very briefly, I'll say we're also looking at the 2024 appropriations bill, making sure they're not including blanket cuts in those. That's where you would see full funding for things like WIC and senior food boxes, which are discretionary funding and not entitlement funding. And then lastly, the Farm Bill, which authorizes SNAP, sometimes called food stamps, TFAP, which is one of the top sources of funding for food banks. It stands for the Emergency Food Assistance Program. And we'll talk about that very briefly on the next slide. And then senior food boxes and food rescue dollars. The deadline for that bill to pass is September 30th of this year. We are hearing that that is not likely to happen and that we may see some continuing resolutions on that bill until we can come to some kind of bipartisan agreement there. So you can go to the next slide. So as I mentioned, TFAP, which is the Emergency Food Assistance Program, provides funding and commodities to food banks to store and distribute food. If you can look at on the right side, you'll see that in fiscal year 2022, we had a huge drop off, partly because there wasn't a lot of extra food in the system to purchase up, and partly because the cost of food have been so high that the same dollar only goes half as far. So we're asking Congress to double commodity purchases to $500 million and double storage and distribution to $200 million. So that will go a long way to helping us feed families across the country. You can go to the next slide. And then around SNAP, I think one important thing to mention is that for every one meal that the Charitable Food Network can provide, the SNAP program provides 9. And as Loree mentioned, that $2 billion in Pennsylvania, that was actually per month that we're now losing that $2 billion. And we know that for every dollar invested in SNAP, that's $1.50 that returns back into our economy. And so you can think about the impact that that has had on especially businesses and small businesses and communities that rely on SNAP as a large part of their income. They are also being impacted in addition to the people who now can't afford food to feed their families. So our priorities around SNAP for the Farm Bill are to increase the purchasing power of SNAP, to upgrade from using the Thrifty Food Plan to the low-cost food plan. And very briefly, that's just what the USDA says the cost of food is for families to be able to afford what they need to feed their families. We're looking to streamline the eligibility and enrollment process so people don't get kicked on and off because of paperwork processes. We're looking to provide better support to people seeking employment, and work requirements is not it. So ending that 3-month time limit, and then ensuring parity for U.S. territories like Puerto Rico and sovereignty for Native communities so that they can have full access to these benefits as they wish. You can go to the next slide. And so just some real short key messages if you are talking to people about SNAP, about why they should care. The first is that children, older adults, and people with disabilities represent 90% of the households who get SNAP. And so we already know that the people who receive SNAP are the most vulnerable people in our communities. They are not sort of living the dream and in eating lobster, as sometimes the tropes like to suggest. Most of the workers who are enrolled in the program are paid very low wages and are in services or sales jobs like cashiers, cooks, or home health aides. And SNAP helps them to afford food and continue to work. The average SNAP benefit is only $5.45 a day. We know some people spend more than that on a cup of coffee. So imagine feeding your entire, all the meals in your whole day for $5.45. It's not a lot of money. Abuse and fraud in SNAP has been greatly reduced thanks to new technology and data matching that enables the program to verify income and other applicant data. And we should continue to invest in those advancements. That's been identified as a top line message for Republicans who are worried about abuse and fraud in SNAP, that it's really very low already. And if we continue to invest in the technology to prevent those things rather than in stricter requirements, we're actually going to be saving money in the long run. And then lastly, that strict, I already mentioned this, that strict work requirements already exist, and that the paperwork is throwing people off. And when we talk about people who are, sometimes they'll call them ABODs, which stands for able-bodied adults without dependents. A lot of times these are veterans. They're people who have disabilities that have not been diagnosed yet. They're not, people that are sitting around not working when they could, because we know that the majority of people who can work do work. And sometimes are in and out of jobs or have unstable employment. But again, that 3-month time limit is very strict and severe. And all it does is increase hunger. And we know that when people are not able to get those benefits and they're hungry, that they come to the charitable food network like food pantries and food banks. And so we're feeding them anyway. And so it would be much more efficient and dignified to allow them to access food on their own in their own communities. You can go to the next slide. And so just a few things here.
Colleen, why don't we just move on? I think everybody can see these. And
go ahead. Let's let Ken jump in. Yep,
let's let Ken jump in. I don't want to miss him. Ken, are you able to get your system back, or are you going to be on the phone?
Yes, I'm
good to have you back. Okay.
I hope you can hear me and see me.
Yes.
Very good. Thanks everybody and for being part of today's meeting. And I certainly just want to echo what the previous speakers have said. I'm Ken Regal from Just Harvest. We're a food justice organization in Allegheny County. And by food justice, what we're talking about in terms of our mission is that the focus of our work is not on distributing food, but on addressing root causes of fundamental.
Your system froze, Ken. If you can hear me, Ken, your system's frozen. Okay, well, Ken is figuring that out. Why don't we go to our final slides, Tiffany, and if we regain Ken, we can come back to him. I just want to remind everybody, we're hoping to get Ken back, but I just wanted to go to our final slides, remind you this is not an off year. We need early support. We need funding. All of these issues need to be supported. We've got, next slide, please.
Yeah, I think I'm back now.
Okay, great. Let's go back to Ken.
Sorry that happened again. I'm having connection problems. On school meals, English class is not on a sliding scale.
Ken, maybe you want to that's not working. We'll send off some of your information as part of our, are you back?
Yes, I hope so. Can you hear me?
Yeah.
Let me get rid of my video here, and that may help the connection. So as I was saying, English class is not on a sliding scale by income, and textbooks are not on a sliding scale by income. If we think of school meals as something that is a fundamental part of the school day, just like textbooks and English class, then it should not be on a sliding scale either. When we talk about the end of emergency allotments, in February, when emergency allotments were still in effect in Pennsylvania, the state government issued $152 million worth of benefits, more than it issued in March when those allotments were no longer in place. So roughly $2 billion a year is the number that's been cited as the loss. But what actually happened just last month is that the spending power for hungry people dropped in Pennsylvania by $152 million. If we think that the private sector, the charitable sector, can make up that.
Okay, we've lost him again. Why don't we finish our presentation, and we will ask Ken to send us a few words that we're going to include in our follow-up to this call. So let's go back to the how have we grown? How have we grown? Well, we've grown by helping sessions like this, educating people on what's really happening in, go back a slide, Tiffany, educating people on what's really happening in Pennsylvania and why they should care. How do you align your values with legislation? You saw the maps of what Pennsylvania looks like in terms of food insecurity. We need folks all over the Commonwealth of Pennsylvania talking about this with their legislators. A lot of those places that are shown on the maps as having food insecurity may be represented by people who do not vote for funding for the schools. Invite your friends and associates to these breakfast briefings. Think about hosting an event with us. We would love to. I used to appear in living rooms all over Pennsylvania, and I'd like to get back to that process, helping to educate your friends and your associates and give generously. A couple of things I wanted to mention right here. Our next two breakfast briefings, the RSVP is in the chat. On May 4th, that's next week, we're going to have an overview of the upcoming judicial elections. I've already got my mail-in ballot, and I plan to fill it out, but many people are maybe struggling on what goes on in terms of why they should care about and what goes on in the various levels of the judiciary. We'll have a session on that next week. 2 weeks after that, we're going to talk about childcare in Pennsylvania. It's at a crisis level. Childcare workers are not paid enough, and there's not enough funding from the state level. So we're going to have Donna Cooper will be with us, along with State Rep Morgan Cephas, to talk about building a stronger village for our children. Check out our website. Invite your friends to join us. Thank you very much. Appreciate everybody being on the call today. Ken, if you can hear me, send us a few paragraphs that you'd like to be included in the follow-up from this, and we'd be happy to do it. So thank you very much, and thanks for joining us. Take care.